Hi, my name is Remy Bulbul. I'm the Manager for Fund Development across Southwestern Ontario for VON Canada. For over 100 years, VON has been providing care, compassion, and service for men, women, children, and families across Canada. From nursing care to PSW care, from working with our children in schools to making sure that you're safe at home. We're going to go and check out some of our programs and hear a little bit more about how they're impacting our clients, our friends, and our neighbors across Sarnia-Lambton. We're sort of talking about how VON really works in a niche kind of a way sometimes to be able to respond to what a specific town even or a region might actually need.
Yes. People often fall through the cracks, and when there's a gap identified, VON has been that organisation that stepped forward, often using charitable dollars to be able to design a programme to fit that need. And making healthcare dollars go as far as they can is pretty much the important bit, because we have an aging demographic. Yeah. People are living longer with chronic disease. Dementia is on the rise, and the needs of the community are just getting more intense. Yeah. So doing more with less is the way to make that those healthcare dollars spread wider. So we're out in the community quite a bit. We do a lot, over 40,000 visits across Sarnia-Lambton every year. So you're one of those nurses and one of those 40,000. What does that look like when you're going into someone's home, and why is that a different experience for a patient?
Patients heal better in home. I mean, they're in their own comfort environment. They're able to rest as needed. We go in, we provide wound care, teaching, antibiotic treatment. So it would be a lot on our healthcare system if patients weren't able to stay at home. Right. We would be overloaded in our hospitals. So it allows patients to heal better. It's a comfort for everybody. Yeah. It seems like it's a lot. Does that, you kind of have to know something about everything. It's not just sort of a really specialized type of nursing. You've got to know everything about that patient and their home and their family and what types of risks maybe are out there. So it's a different type of nursing, right? The thing about community nursing is as much as you're in there alone, you're never actually alone. Yeah. We have great teams that we work with, great doctors that we work with. Our palliative care physicians are phenomenal. They make in-home visits. Yeah. So we're pretty lucky that we're able to maintain people, and it's when we're in homes, we're not just caring for the patient. A lot of the times we're caring for the family members. And a lot of the times that has to do with, especially our end-of-life patients. Yeah. You run so many volunteer programs here.
We've got quite a few, yeah.
And those volunteer programs really keep people safe. They keep people in their homes, and they keep people engaged in their community, right? So tell me a little bit about some of the programs that you guys are running.
Well, we've got all of our volunteer visiting programs. We currently have 3 volunteer visiting programs that are active. We're adding 3 more. So one is our caregiver respite. So it may be that the client has dementia or another medical problem that their family member doesn't feel comfortable leaving them. Yeah, of course. So our volunteers will go in and visit. They're not providing medical care, but it's someone to call 911
just a physical
if
person there to make sure that they're safe.
Yeah. So then we have our in-home smart, which has really taken off, and it's so exciting to see the difference in the clients before and after. The volunteer goes in and teaches them a series of stretches and exercises that are designed to prevent falling. And
in their own home.
In their own home. Yeah. So we know what falling can do for a senior and how dangerous it can be. Yeah. And what's really exciting is that we see people all of a sudden at the end, they'll go for a walk to the corner.
When they weren't able to.
And they couldn't even get out of their house before, and they're excited. We have the clients set a goal of what they want to be able to do, and hopefully we can do that with them at the end of the goal.
That's incredible. That's incredible. We're letting people sort of live every day at home how they want to live their lives with some say around how that goes, right? Instead of being in a sterilized hospital, which quite frankly is just a lot more expensive.
VON recognizes its part in the whole continuum of care in each community. So where VON is able to step up and provide the solution, we do. Where it's not appropriate, we partner.
We're out at the Sarnia-Lambton Adult Day program, where we've got about 11 clients a day who come out to take part in activities.
That's right. Active activities helps them with their strength and balance, because a lot of the clients that come from home, they're not engaged enough.
We've also got a PSW who is here at the Adult Day program seeing patients every day and interacting as well. How has that sort of changed that experience for a client? What is that PSW sort of doing with them?
So the PSW are here to assist clients that require more care, assisting with toileting, helping with one-on-one Montessori activities, and to help de-escalate behaviors as well.
Yeah.
PSWs have a lot of say within the care plan. If we notice some clients when they come here, it's depending on what stage of the disease they have with Alzheimer's or dementia. If they're a little bit more progressed than some clients come here, they may have the illness and they see that they're not as progressed, so they don't really associate with it. Or on the flip side, they progress pretty far into it and they're agitated. They don't understand their surroundings. They don't really get it. And then after a couple of visits, you'll understand and you'll see how their mindset will change. So it'll be like, oh, these are really nice people. They actually want me here. They want to see me. And it's not just kind of like being left alone.
Yeah, it's just not a place to be and park you on a chair in front of a TV, right?
No, it's actually very interactive.
Yeah. So another way that VON is really innovative, I find, is in our use of technology and how we use that to not only provide a better sort of patient or client experience, but also to be more effective in the way that we spend money, as well as time, right? So one of the new programs is our virtual volunteer visiting. The virtual visiting really pairs a volunteer through technology to somebody who's isolated in the community, who either doesn't want someone in their home and they're not comfortable, or who maybe isn't able to, a volunteer who isn't able to get out but really wants to volunteer. So they're paired with sort of a tablet, and then they can have a virtual visit. But it's nice because that person who's isolated and alone, they get an education around how to use technology to connect with people, right?
That's right. And recently announced there's going to be even more healthcare delivered via virtual. And so we're going to be able to help teach the seniors how to use that, because they're going to have to need it for other things as well. So that just gives that extra double bonus. That will be huge, and it's nice to be able to be a part of that.
Exactly. What other kinds of ways are you utilizing volunteers? So between our boards, between our volunteer visitors, also with different programs, right?
Yep, we use volunteers here in the office. Our foundation board is all volunteer, and they do a great job leading the foundation. We use volunteers for all of our special events. We also run the SMART program with the exercise program, and many of those are led by volunteers. And then we use volunteers at each of our foot care clinics.
So what was it, Hank, that caused you to kind of come into the foot clinic for the first time?
I had some problem with an ingrowing toenail, and you start favoring one foot.
Right.
And then your back starts to hurt. You know, like everything.
Absolutely.
So I came down here, and Margaret helped me out, and it is beautiful now. I can walk normal.
So there's a number of reasons why people come to our clinic, and that's one. You can have problem feet. Sometimes it's just that people can't see anymore, don't have the vision to
take care of
see
their
what
own
they're
feet.
doing. Or they might have decreased flexibility from painful arthritic joints.
Of course.
And then as we age, we develop natural problems that just come along, like thicker nails, dry skin, calluses.
Right.
And any disease process like diabetes and arthritis, you're bound to get different problem areas, things that we can treat here at our
improved
clinics.
my walking, definitely.
Really, eh?
So
So you're able to walk a little bit more, you can exercise a little bit more, you can just do more.
I have no problem now at all.
Well, it's nice because you get to know somebody as well, right? You're sitting, you're talking, you get to know
it tends
maybe
to be kind of a social time.
Well, it's hard too, right? Sometimes you get a little bit lonely even. People get isolated. We've got our volunteer visiting programs and things like that sort of help with some of that. But it's nice to even just sort of get out and just be able to socialize and chat with somebody every now and then,
especially
right?
when I have an issue, I just tell Margaret, and she takes care of it right away.
And that's it.
Yeah,
She's a fixer.
She really is.
I love it. I love it. There's some misconceptions that people have about VON, that we only work with seniors, or that we only work in nursing, which couldn't be further from the truth, actually, right?
That's right. No, it's an incredibly diverse organization, and a lot of people who think that they know VON don't really know VON. We have programs that deal with children right the way through to end-of-life palliative care.
So you are team lead here in Sarnia-Lambton for our occupational therapy programs, right?
Yes.
So tell me a little bit about that. I know we've got our adult programs, but we also have some kids programs as well.
Yes, so we see people out in the community, and then we also have our school-based program where our OTs go into the school for children that are having difficulty with fine motor skills, printing, or also sensory issues, so being able to cope in the classroom with the busy environment and things. It's really important to see kids within their environment. Kind of, what they do at home might be very different from what they do in school.
So do you also work with their families then in that case, with the kids for that educational piece even outside of school?
Our therapists would go in, we do an assessment with the child, but that's a part of that assessment is getting information from mom and dad as to what they do at home and what their concerns are, what they do within the classroom, so talking to the resource teachers and the teachers as to what they do and what they see as concerns and how that child is functioning within the classrooms.
We see kids right from JKSK right until grade 12, 13 in high schools. So, we go in depending on what the child needs. So a lot of ours are, frail diabetic children who need assistance with their insulin, children who need assistance with feeding tubes, feeding pumps. Some children can't be put on a feeding pump, so we actually have to syringe feed them, which means we sit there with them for a few hours a day. But this allows children that wouldn't otherwise be able to go to school.
We're talking about the Memorial Garden, which is a beautiful space down by the lake where family members can go to remember. Tell me a little bit about how that got started.
Absolutely. So it actually started out of adversity. So the Hezefka family unfortunately lost their son, Marshall, in an accident on his birthday on September 20th. And so the Hezefkas wanted something that they could give back to the community and help other families remember ones that they've lost. And so the Memorial Garden was born, and we actually have a ceremony every September 20th to remember him birthday. And remember those families.
That's really beautiful. So we've got this beautiful wall that's got people's names on it the day that they were put on there. Tell me about how people use that space every day outside of the ceremony.
For sure. It's definitely a very special place in our community. So every year we have families that bring forward names of their loved ones that have passed away. And it's really just kind of a coming together and a celebration of life, essentially. And the space is so crucial for the people in our community. We've had lots of people mention that this space in particular is the only space they have to remember their loved one.
So is that what you hear from a lot of families that you work with on this every year? That
Absolutely.
That's just sort of their quiet space that they're able to sort of sit and remember?
Yeah, that is absolutely their sacred space where they can go and really feel comfortable and just remember and reminisce. It's really quite special.
So we don't do any of this alone. We depend very heavily on our community, right? Some programs are funded completely through donor dollars, right? They're funded completely through charitable dollars. But we do that work in partnership with so many other people. I think that it's interesting that people don't necessarily know that VON is a charity, right? That VON actually needs their help.
VON helps to pull all that together through identifying unique programs and partnering with others. And oftentimes it's the charitable piece that allows those programs to start.
Right.
And there's been a whole number of programs that VON has innovated around using those charitable dollars that are now part of the fabric in communities.
Right.
And that's really important.
So it's up to our communities to be able to do that.
Yeah, VON has incredible people working there, people that literally give their lives to the care of others. And that's not just the staff, it's people that volunteer as well. I mean, we have volunteers that have